And joining us tonight is Dr. Ken Redcross. He is a board-certified internal medicine physician. When we hear this, I mean, there's so many levels to this, but let's look at the medical for a second. This is a 13-year-old boy.
Yeah, and there's a lot going on here, Gene, and what we've just heard. Number one, we're talking about the father putting all of his body weight on this 14-year-old boy. There are so many injuries that can happen intra-abdominally. We're talking about the bladder, the kidney, laceration of the liver. The other thing that we have to talk about, of course, is this dog collar. You know, the interesting thing, even in the canine world, it's kind of looked down upon to actually have your dog shocked by this. And now we're talking about a child. Keep in mind that our heart is pretty much an electrical current that works. So here you are having something on the outside introduced and can actually cause arrhythmia and even death. You just do not know, especially in a child.
Let's go to victim number 2 for just a second. This is his daughter. By the way, her birthday is today. She just turned 12 years old. Listen to what she told authorities. She said victim number 2 stated that her father had hurt her countless times since she was approximately 4 to 5 years of age. Victim 2 explained that her father has struck her on the head with various types of sticks and or PVC pipes over an estimated 100 times, causing her to see stars on many occasions. Doctor, I just want to ask you one more thing. She was also hit countless times in the stomach.
Yeah.
He would stand on her stomach with his shoes on, allegedly.
Right.
Will she ever be able to have children? Will she ever be normal?
Thank God, the blessing is that she is younger at this point and not necessarily at the childbearing age, but it's the emotional aspect that may make it hard for her to actually get pregnant and move forward in her life and other relationships. That's the charge and the thing that I worry most about also.
Right. You wonder if they will ever be normal. Well, joining us now is CNN legal analyst Ariva Martin and Mark O'Mara, who also represented George Zimmerman. Thank you both so much. It's an honor to have both of you here tonight. Mark, how do you defend this?
Well, you don't defend the individual acts at all. You have to hope that there is some mental health defense to this. You have to hope that whatever led a father who is supposed to be a protector of his children to not only neglect them, but to actually and actively abuse them in a way that's horrific and over such an extended period of time, I only pray that he is not fully responsible for his actions and that we're going to find, as a good defense team will look into, some type of a mental defense, some type of a mental health problem that led to this horrific act, because there's nothing else that you can say about it.
Ariva, here's what's so strange. One child is 13, and the little girl's birthday is today, so she's 12. They're saying that it started about 6 years ago. So they were about 5 years old and 7 years old. So he didn't do it from when they were a baby.
Yeah, something obviously triggered this behavior. And what's really concerning to me, Gene, is typically if kids go to school, this kind of abuse would have been caught by the school teachers, by the administrators, because there would be marks and someone would have reported it to the police or the Child Protective Services. But what we're hearing in this case is that these kids were homeschooled, leading me to believe they were isolated, kept out of the public's eye, and this is why he could get away with this for so long. But I still have to ask, where was the system? The system failed these 2 children, because no children should have to be abused like this for this number of years. And I hope, Mark, there's going to be some evidence there to show a pattern or a past of mental health, because right now all we have is a monster and no evidence that there's mental health issues that, is the cause of these kinds of horrific acts.
And it is horrific. We have something else to show you here about one of the young victims and a dog collar. Remember, it was an electric dog collar. And victim 2 went on to explain what that dog collar was, that her father would give her the option of being struck with a stick or being shocked with a remote-controlled electric dog shock collar. Victim 2 stated that there were times that she begged for him to use the shock collar because it hurt less. And Mark, what the little boy is saying is that it could go up to 100, but usually he would set it at 40. But if the little boy was real bad, it would be set at 100. Obviously, the wife was a victim here, too.
Well, and there's a concern here.
Is the defense going to go to her that she participated in this?
Well, she was obviously a victim. It seems that way when you have that type of horrific injuries perpetrated upon the wife as well. So I'm not going to go as far even in any defense theory to say that she was some co-conspirator. But unfortunately, because she was a victim and felt whatever pressure she had, and I've seen it so many times before, Reeve, I know you have, only support for the family, no other outside support. Whoever she may have gone to for help couldn't help her. That she stayed in a relationship that not only exposed herself to abuse, but exposed the children to horrific abuse for 6 years. But there is a certain amount of blame, and I know we're not supposed to blame victims, but there's a certain amount of responsibility on mom for not getting out. And like you say, for the system for not having a good avenue for an abused mom to get out with her children.
You know, Mark, we've got some pictures inside the home. Let's look at that right now. We can see what authorities saw. I mean, that's a nice house. I mean, you would never dream that something like that happened. Solomon, I think you were still with us. I want to ask you, the defendant in this case, Joseph Myrie, he was actually questioned by authorities, and he said a lot, didn't he? What do you have to say to them?
Well, he said that, yes, he did abuse he did hit his children. He did discipline his children, but that he never hurt his children, which is really the complete opposite of what the children said. They said that they would pass out. They said that when he strangled them, there would be marks on his neck. They said that, you know, he would hit them on their feet until they couldn't stand up. And so what he said, he admitted that he disciplined his children, but he said that he did not hurt them.
You know, Ariva, in cases like this, we always say, what about neighbors? Somebody had to know something. And then once it all comes to light, they say, oh, I knew something was going on there. Something was strange.
But people often don't want to get involved. They'll see these signs, but they just ignore them. And I think what we also know about this case is that the father coached the kids to lie. So if someone saw them and saw that there was a bruise or a mark, he told them to say they had fallen down or some kind of accident occurred, again, to hide this behavior that he was engaged in. I think it's important to note, when you look at that house, beautiful, clean, looks like your typical middle-class family. But that's the face often of this kind of violence. It's not, you know, what people think, a home that's in total disarray. It's that house that looks so well put together, where there's often women who are abused by men, and because they can't get out of, their kids suffer as well.
And Doctor, there pediatrician visits through the years.
So that's exactly where I was going with this, Gene, because this is where the medical community comes in as well. Because lots of times we're actually the first line to actually see these things and have this little child and wonder, why are we seeing marks around the neck that just do not add up? And you have to sometimes separate the child from the parents and have this really discussion about really what's going on in the home.
But this is assuming that these kids were even going to the doctor on a regular basis. We know they were homeschooled,
cases where they don't.
So they may have been isolated and not going around, you know, outsiders at all.
Right.
Yeah. Well, more will come to light. Thank you all.